So, formerly we spoke about bladder tumors, all right, where I told you guys that our next lecture will be the bladder cancers. And I told you guys that bladder tumor is basically like cells in the lining of the bladder are growing abnormally, okay? So instead of them growing up with commands like, hey, you have to grow to this particular stage before you stop, they are growing without roots, right? So they are just growing, they are just becoming so large, right? So you see bladder tumors, right? So you see bladder tumors, right? On the linings of the bladder, you have some abnormal cells. It could be the cells of the bladder, also known as urothelial cells, right? But they are abnormal now, right? Since they are growing without control, so we call them abnormal cells, right? So they grow at one particular part of the bladder, and they actually get to form like a heap of cells, also known as a tumor. All right. So this tumor will result into what we call bladder cancer. All right. So what is bladder cancer? Now, bladder cancer is basically a whole crazy concept, right? And we can't just start talking about bladder cancer haphazardly. We actually have to actually list it out, like the definition, the symptoms, the causes, the risk factors, right? Risk factors is basically like people who are like mostly prone to actually have bladder cancer, right? Then complications, we talk about prevention, talk about diagnosis and treatment. Okay, so ready for the ride? Now, first of all, the definition. Bladder cancer is a type of cancer that originates from the tissues of the urinary bladder. Right? There are different types of cancer, but this one we're talking about just the bladder one. All right. So it's a type of cancer that originates from the tissues of the urinary bladder. Now, here are some key points. Okay, here are some key points to note about bladder cancer. First of all, the symptoms. The most common one is blood in urine, also known as hematuria. Okay, hema means blood, urea means urine. So blood in urine. So blood in urine is a common symptom. If you notice any blood in your urine, you should seek medical attention promptly. Then painful urination. That's the discomfort or pain during urination can be an indicator of bladder cancer. Then low back pain. Persistent pain in the lower back may be associated with bladder cancer. Frequent urination and increased need to urinate, especially at night. An increased need to urinate, especially at night, is what we call nocturia. Okay. Then there's rapid weight loss, there's loss of appetite, there's extreme weakness. Okay, and all these are also potential symptoms of bladder cancer. Then causes and risk factors. First of all, I think we'll be coming up with the causes. We said that bladder cancer occurs when abnormal cells in the bladder lining become malignant. So earlier on, they are benign. Okay, they are growing, but they are benign, they are harmless. Okay, but if left there, if you are seeing blood in your urine over some time and you didn't seek medical attention, this can lead to the cancerous state. Okay, you could see a tumor, abnormal cells growing in one particular part of that cell or organ. So now, what are the risk factors? Risk factors is basically what is the type of lifestyle, okay, that if you engage in, you'll be more prone to having bladder cancer. First of all, we have tobacco users, people who smoke, okay, are more prone to having bladder cancer. Occupational exposure to certain chemicals, right? Maybe you work in a chemical industry, you guys inhale it, cement factory, agricultural, all these agricultural, how do I put it? Um, Let me say they are making all these agricultural pesticides, herbicides, okay? Those are the certain chemicals, right? Then radiation exposure, maybe X-ray, MRI scan, CT scan, okay, prone to having bladder cancer. Then recurrent bladder infections. If you're having so many other bladder infections, but you are not treating them, okay, or you are not seeking the right medical attention, but rather taking some shortcuts back doors to getting yourself healed, then it can also get to result in cancer. Now, what are the complications? We said that if left untreated, bladder cancer can spread to nearby organisms. Of course, cancers metastasize, okay? So they spread. Do you understand? Cancers spread. It can also affect pelvic lymph nodes, okay? It can metastasize to liver, lungs, and bones. It can lead to anemia, it can lead to urethral stricture, and can lead to urinary incontinence, okay? Now, what is the prevention? Now, why there's no guarantee way to actually prevent this bladder cancer, adopting a healthy lifestyle can actually minimize this risk, right? As for me, I've never ever tasted alcohol in my life. I've never ever smoked, okay? So if they say that if anything will kill me in this world, there should be meat, okay? Because I eat a lot of meat. I eat a lot of healthy food, all right? So if healthy food actually kills somebody, then I'll probably die, bro. So avoid smoking, consume fruits and vegetables rich in antioxidants, right? Let me show you guys something. You see this? This is just for the night, bro. Okay? So consume fruits and vegetables rich in antioxidants. Maintain adequate fluid intake to flush out harmful chemicals from your bladder. Okay. So, diagnosis and treatment. We have cystoscopy. A cystoscopy is a procedure to examine the bladder and the urethra using narrow tubes with a lens. You understand? We have urine cytology, which detects what cancer cells in the urine. Okay. We have urogram and retrograde pyelogram. This will evaluate the kidney and urinary tract conditions. We have bladder biopsy. Anything biopsy is basically taking out cells from that part of the body to actually go to test out, right, if there's any abnormality in them. So bladder biopsy is like you collect tissue samples for laboratory analysis. Then treatments options include what surgery, chemotherapy, biological therapy, all right? So ending up with stages of bladder cancer, I think I'll be making a video on this, right? It's good to just make video on everything, all right? Stages of bladder cancer, stage 0, stage 1. It basically shows how the tumor is actually growing, okay? So specialists you should see if you have cancer of the bladder are urologists, which specialize in urinary tract diseases, and oncologists, which diagnose and treat cancer. All right. So guys, that's it about bladder cancer. Talking about definition, symptoms, causes, diagnosis, treatment, preventions, and everything. All right. So that's it. See you guys in the next. All right.